2023 Personnel Committee meeting. Is there any courtesy of the floor?
Yes.
Yes, sir. Go ahead.
Thank you, Madam Chair. One thing that was brought to my attention, Section 1002 of the Home Rule Charter under membership, authorities, boards, and commissions. Line E says prohibition, no elected official, officer, or employee, and no member of any other authority, board, or commission shall be a member of a board or commission established under subsection 1001B. And under 1001B are the Personnel Appeals Board, the Revenue Appeals Board, the Election Commission, and the Personnel Commission. Now, it's come to my attention that there are two members of the Personnel Appeals Board who serve on other authorities, boards, and/or commissions. There is one member that serves also on the Airport Authority, the Graysdale Advisory Board, and the Workforce Development Board, and another one who serves on the Land Authority, as well as being a member of the Personnel Appeals Board. So I think it's worth noting that I would be troubled by those appointments, and that I would hope that that would be reviewed and rectified in the future. Thank you.
Can I ask you a question?
Sure.
Are these past appointments, or are they something that we're going to be dealing with this evening?
These currently exist. One was a relatively recent appointment, and I can't recall when the other individual was last appointed.
Do we have any recourse if we've appointed them? Can we rescind the appointments, or what?
Well, under Section F, it indicates a forfeiture of office. A member of an authority, board, or commission shall forfeit his office if he, at any time during his term in office, lacks any qualification or violates any prohibition prescribed by this charter. So that is the recourse, and I just thought it's worth bringing to the attention of council that those are appointments that we have approved in the past that are in direct conflict with the Home Rule Charter.
How many were there?
There are two individuals.
Can I ask who's speaking, who the courtesy of the floor was? Okay, thank you. For a thought.
That's all I had.
Thank you. Okay. So, Mr. Spadoni said he'll meet with the clerk after the meeting, and that we'll take a look at that and then determine the next best course of action. Any other courtesy of the floor? Next, we have a review of the county executive's appointments and reappointments. First, we have the Area Agency on Aging Advisory Board. First appointment is Ann L. Anderson from Easton, Pennsylvania, being considered for a 2-year term to begin June 16th, 2023, ending June 30th, 2025.
And move that forward.
Thank you. Second is Ginger DeBias, Easton, Pennsylvania, considered for an appointment, 2-year term, June 16th, 2023, ending June 30th, 2025. And these are all attached resumes as well.
Move forward.
Thank you. Next, we have appointment Sandra Volcano, Easton, PA, considered for a 2-year term beginning June 16, 2023, ending June 30th, 2025.
Move forward.
Thank you. Next, we have a reappointment to the Area Agency and Agencing Advisory Board, Elaine A. Arntz, Easton, PA. Ms. Arntz is being considered for a 2-year term beginning July 1, 2023, and ending June 30th, 2025.
Move forward, please.
Thank you. Also, a reappointment is Yolanda Braun, Easton, Pennsylvania, considered for a 2-year term beginning July 1st, 2023, ending June 30th, 2025.
Move forward.
Thank you. Next, another reappointment, Gladys Marie Harris, Easton, PA. Reappointment considered for 2-year term, July 1st, 2023, and ending June 30th, 2025.
Move forward.
Thank you. Paul G. Nagy, Hellertown, Pennsylvania, reappointment, considered for a 2-year term beginning July 1st, 2023, ending June 30th, 2025.
Move forward.
Thank you. Another reappointment, same agency on Aging Advisory, Robert Predapapa, Bethlehem, PA. Mr. Predapapa is considered for a 2-year term, July 1st, 2023, ending June 30th, 2025.
Move forward.
That ends the Area Agency on Aging Advisory Board appointments and reappointments. Then we have an appointment to the Children, Youth, and Families Advisory Board for Sandra Stewart Barrett, Nazareth, PA, considered for a 2-year term beginning June 16, 2023, ending May 1st, 2025. Resume is attached.
Move forward.
Thank you. Next, we have a reappointment to the Drug and Alcohol Advisory Board, a Nancy Deno, Easton, Pennsylvania, 2-year term beginning July 1st, 2023, ending June 30th, 2025.
Move forward.
Thank you. A reappointment for Maria Antonia Mittman, Easton, Pennsylvania, being considered for a 2-year term beginning July 1st, 2023, ending June 30th, 2025.
Move forward.
Thank you. Next, we have Workforce Board Lehigh Valley recommendations. An appointment for Rebecca Anderson Nowry, Easton, PA, considering for a 3-year term beginning July 1st, 2023, ending June 30th, 2026. This position represents the A1 small business category. Resume is attached.
Move forward.
Thank you. Next is a reappointment for Joseph Kowalczyk, Northampton, PA, considered for a 2-year term beginning July 1st, 2023, ending June 30th, 2025. This position will represent the B4 organization with experience and expertise for youth category.
Move forward.
Thank you. Next, we have a reappointment for Debbie Rice, Bethlehem, Pennsylvania, considered for a 2-year term to begin July 1st, 2023, and ending June 30th, 2025. This position will represent the E-optional category.
Move forward.
Thank you. Reappointment of Jane Brooks, Easton, Pennsylvania, considered for a 3-year term to begin July 1st, 2023, and end June 30th, 2026. This position will represent the A business category.
Move forward.
Thank you. Reappointment to the same board, Michael Woodland, Nazareth, PA, considered for a 3-year term, July 1st, 2023, ending June 30th, 26. Position will represent the A business category.
Move forward.
Thank you. Next is a reappointment for Paul Anthony, Bethlehem, PA, considered for a 4-year term to begin July 1st, 2023, ending June 30th, 2027. This position will represent the labor category.
Move forward.
Next is a reappointment to the Workforce Board, James Irwin, Nazareth, PA, considered for a 4-year term beginning July 1st, 2023, ending June 30th, 27.
Move.
Representing.
Madam President, I'd like to stop. This individual currently sits on one of those boards that the prohibition exists from them sitting on another board. So I think that that needs to be brought up, and that prohibition needs to be enforced.
Get some ruling on it? We'll table it. Can I make a motion to table it? Mr. Irwins? Until we get some clarification?
That would, I'd be fine with that.
So that means it would not be moved forward
We
till
won't be
tomorrow.
moved forward, we're going to table until we get some clarification on.
There was a second.
Second was by,
Is it already on the council meeting?
what's the time?
For tomorrow night, but I don't think we move on if we have to amend the resolution tomorrow night.
Right, that's right.
I'm reappointment to the Workforce Board, John McDonald, Bethlehem, PA, considered for a 4-year term beginning July 1st, 2023, ending June 30th, 27, representing the A1 small business category.
Move forward.
Thank you. Reappointment for David Wolf, Easton, PA, considered for a 4-year term beginning July 1st, 2023, ending June 30th, 2027, representing the A1 small business category.
Move forward.
Thank you. That is all I have for appointments. Next, we have a personnel request from the District Attorney's Office, the Assistant Attorney Promotions, longevity incentive bonuses for certain Assistant District Attorneys. There's a resolution here. Let me see. Do you want to speak to it before I read the do you want to speak to it, Mr.? How?
Sure. We'll deal with the promotions first. Good afternoon, Commissioners. I hope all is well. I've recently promoted 2 Assistant District Attorneys to the position of Deputy District Attorney. I've given a memorandum. I hope you have had an opportunity to see it and receive it and read it.
Could I just stop?
Yep.
Is there do I hear noise?
Yeah, there's a reverb in the,
Oh, is that it?
yeah.
Okay.
Yeah.
I thought it sounded like a radio, but, okay.
Basically, I'm coming before council because I'm requesting a 1-step increase over the calculated promotion salary, which will reflect not only their level of experience, but the increased nature of the responsibilities over and above the normal promotion they're receiving. These increases, however, will represent an overall salary decrease from the amounts the prior attorneys were being paid. This, in turn, will represent an overall decrease in expenses to my budget.
So this is the resolution that the one full-time position of Assistant District Attorney, pay grade CEGR-033C, salary $71,565, upgraded to one full-time of Chief Deputy Assistant District Attorney.
Deputy District Attorney.
And that would be a pay grade increase, and salary $82,329. And then a second one is the same level, same title, correct?
Yes, that's correct.
Madam President?
Yes, sir.
Clarification. On one, you have chief deputy, and the other one's just a deputy.
They're both just deputies.
So we
They're
need to
both
strike chief from.
Yeah, I didn't see the resolution, so yeah, they should both read from Assistant District Attorney to Deputy District Attorney.
So in the first paragraph, we'll strike the word chief for tomorrow night.
Yes.
And this doesn't affect your budget?
No, my budget actually is decreased by this.
Okay.
Any other questions for Mr. Howe?
Thank you. Could you just tell us a little bit about what additional responsibilities come with the upgrades in the position?
Sure, when someone is made a Deputy District Attorney, they become Chief of a unit, as opposed to an Assistant District Attorney. And so they'll be in charge of other individuals. They're also in charge of screening cases, fielding questions from the Assistant District Attorneys in their unit. They're also mentors. They're also responsible for holding certain continuing legal education classes. And they have also they're part of now a leadership group in which we discuss overall issues, the office, things that need to be attended to, and things of that nature. Yep.
One follow-up question. Staffing, is your staffing going to be fine? Or are you losing or are you gaining?
Well, we're down, which is part of the next resolution I'm requesting, but
Okay.
As all district attorneys or offices are down, we are down, but we're doing okay. You know, we're we're not at a stage where any of our services are impacted at all, which I'm very proud to say.
Okay.
Okay, any other questions? Can we move this forward?
Yeah, I'll make a motion, we'll move it forward.
Thank you. And next, we have a proposal for longevity incentive bonuses.
Yes, you may remember, I did this last year as well, when we were down people. We continue to be as short-staffed as every other district attorney's office in the state, as that is part of the memorandum that I sent to you. Due to these staffing shortages, the district attorneys obviously are required to pick up the slack as a result of these staffing shortages. They also are not subject to overtime and not permitted to have overtime. And as such, I am requesting this $3,000 stipend, one-time stipend for the district attorneys that have been holding the line throughout this year. Interestingly enough, I managed to find didn't take much. I found an article in the paper from April 21st out of Montgomery County, where I think they saw me do this last year, although I'm not 100% sure. And they are doing the same thing, only they're asking for $4,000 and they're giving it quarterly to their assistant district attorneys. I'm asking for $1,000 less, and I'm only asking for one time. And my budget, again, is not affected at all. I'm not asking for any increase in budget. This will be absorbed by the positions that we haven't filled.
Any other questions?
Yeah, I appreciate the article that you showed where all the other counties that were also advertising. Is there a shortage of attorneys coming out of law school?
That's a
or
great
what's
question.
the
I mean,
issue?
That's a great question, and I think this is related to COVID because it affected us most when COVID happened. But there seems to be a bit of a pendulum swing in which people. I mean, there was a time in my history when we would have a dozen, maybe 24 people waiting for a job. Mr. Spadoni, I'm sure, could speak to that. But that has long since passed. And now the position of district attorney is very, very competitive, and it's affected throughout the entire state. It's affected throughout the entire country. Attorney General's office, the United States Attorney's office, where we lost one attorney to them as well, and they're all offering a lot more money. So that's what's it's hard to turn that down, as dedicated as they are. So. There just seems to be this move away from prosecutions. I don't know the exact reason, but there is an active recruiting effort, not only by the District Attorneys Association, but by our office as well, that stretches all the way down as far as Philadelphia and all the way up to Schuylkill County.
Yeah, that was going to be my next question. This is often a first position for many attorneys, or one early in their career. So are we going to law schools? Are we actively recruiting that
Yes.
way, or how does that work?
As a member of the Board of Directors of the District Attorneys Institute, they are actively recruiting in the law schools. But the interest coming out of law schools is probably where it hurts the most. And we are actually hiring people of experience, which is another reason why you have to be more competitive, because when we get people with experience as a lawyer, you're almost duty bound to offer them more money than the incoming DA.
Yeah, and then over the years, we've moved from less part-timers to more full-timers.
Yes.
Does the pendulum maybe need to shift back so you can attract some part-time people who may want to do this as a supplement to their income?
Yeah, I'm not beyond that, and that has been explored. This is I look at this. I always have looked at this as a full-time job, but in the event that we need to do that, we'll absolutely go to a part-time position if needed, and if we can get somebody that's interested in doing that. Yeah.
Thank you.
Yeah.
Any other questions? Mr. Lott?
Yes, I'm not on the committee, but thank you. How many vacancies are in the district?
I think we got about 4 now. And it's not so much the vacancies as it is the people that are coming in. You know what I mean? Like, you don't used to have this supply of people that you could go through. And it's more, because people that are leaving for really good reasons. I mean, they're getting a lot more money, and it's hard to say, well, yeah, don't go. But it's people applying that is usually the issue. But again, I don't want to cry here or whine here, because we're doing better than the vast majority of DA's offices. I mean, what's going on in the bigger counties, Allegheny, Philadelphia, and even in Bucks and Montgomery is staggering. Montgomery, I think, has lost 22 attorneys in the last couple of years. Allegheny, I was told, have lost over 20 just this year alone.
I appreciate you adding that, because the Pennsylvania District Attorney Association did do a survey study of
Yes.
third-ranked counties,
Yes.
which is us, and I looked at that.
Yes.
And I'm glad you said we're not doing the worst, because we're definitely not, as far as third-rate counties, we're up there as far as our salaries. Now, it doesn't compete with the rest of the people you just said.
Yeah.
But as far as counties our level, if you look at this survey they did, we're, I think the only ones ahead of us out of the, I think there was 11 or 12 different counties, was Lehigh County. So I mean, it's a big study, there's different positions.
Yeah, I'll say.
So I'm very generalizing it, but we weren't certainly on the bottom half of that
No,
list.
and there's been no, although we're not the best when it comes to incoming salaries, okay? Those numbers are moving, and Lehigh is above us by $4,000 or $5,000. Where we are way behind is in paying attorneys with experience. We just don't seem to do that here, and there doesn't seem to be a vehicle to do that. So when an attorney, as Mr. Kuzak has already brought this up, when an attorney with 5 years of experience comes to our office interested in a position, it's very difficult for Northampton County to compete with the other counties, be it level 3 or 4 or 2 size counties, because they offer them more money, because they give them credit for the experience they have coming in. We don't seem to do it as much.
Can I ask one more question?
Sure.
These people that are being moved up to, how long have they been with your office?
My office, or how much experience do they have?
Let's start with your office and then.
Okay, well,
That'd be great.
The Julianne Danchak, I believe, has, I want to say about 4 or 5 years' experience with us, but she was also in Berks County before she came to us. And Patricia Turzin's been with our office, I believe, 3 years, and has had experience as an attorney in Montgomery County before she came to us.
Just for my own knowledge, is there an average length of stay people stay in the DA's office?
There is not.
Is it a 10-year? Is it an average?
No, it's again, it's a transient position, and most attorneys aren't like me, or Bill Blake, or, they tend to leave, but they stay for years longer. In this situation, they're going drawn away from us quicker because there's an offer for more money at competing law enforcement, be it attorney generals or United States attorneys or other district attorneys' offices.
Thank you.
You're welcome.
There's somebody, you have their dates of service in here, but there's somebody that says 16 years of practice but no years in the office. Is that somebody you're hiring, or was that just a mistake? George Mullers, is that the?
Yeah, George, we hired George beginning of this year, and he's been a 16-year lawyer out of Northampton County. Very valuable to us because he brought a lot of experience, and we had to bring him in, as you can see, at a starting salary, even though he's been a lawyer for 16 years.
Yeah, the only thing that I see, and again, it's your job as a manager, not mine, but if I were somebody who had the longevity of some of these people that have been here a long time, and you were going to give the same bonus to somebody who just came here for a year, I don't know how I'd feel as a colleague, but that's your business as a manager. But I see that you say it's an incentive / longevity bonus, so I guess that covers everybody.
Yeah, the incentive is for what they're doing in our office. Since I can't bring them in, or there's a great difficulty bringing them in for a 16-year lawyer, because I would have to do that. I would have to jump people that have been in this office maybe for 10 years over them, which is it's just not something that is viable here. But the incentive has a lot to do with what they're doing here, picking up the slack for other attorneys, whether they have 16 years as a lawyer or less.
And how many people do you have besides those that aren't eligible for this bonus, or that's your staff right
We just hired a couple of new ADAs that aren't included all in this list, and they're not subject to that.
now? Okay. Anybody want, move this forward?
Just
Or
one
you
other
want-
question. How many of these folks expertise are juveniles?
I'm sorry?
You got any of these folks that you,
Sure, yeah, well, yeah, the Deputy District Attorney in charge of our juvenile division is on this list, David Sorrell, yes.
thanks,
Yep,
Can I have a motion to move forward, please?
motion.
Thank you. Thank you, Mr.
thank you.
Thank you for being here. And if you want to, I don't know if you want to be here tomorrow, just in case
Yep,
there's questions.
okay.
Thank you. With
Thank
that,
you.
Is there anything else for the Personnel Board? Personnel meeting, sorry, the board, I don't know. Okay, then I surrender and adjourn and move to the Finance Committee meeting.
So I guess I'm on.
Thank you.
All right.
Thank you for saving my
Welcome to
voice.
the Finance Committee meeting. We'll open with courtesy of the floor. Is there anyone who would like to address the Finance Committee at this time? Okay. All right, seeing none, we'll move into the business portion. First item is the Controller's reports. Mr. Zaborski?
Thank you. I have two items to review with you this afternoon. The first is the statement of indebtedness for the year ending 12/31/22. To comply with Article 4, Section 402-3 of the Home Rule Charter, the Controller's Office annually prepares the statement of indebtedness. This is accomplished as a non-audit service and is not an audit. The source for most of the information in the 2022 long-term is 2022 long-term debt, year-end binder, along with the permanent binders, hard copy and electronic, the previous year's binder, the 2022 general purpose financial statement, and information from the Finance Office regarding the amortized premium and discount on bond issues. There were no new bonds issued in 2022, and no bonds were refinanced. In 2021, the county entered into a long-term lending agreement to finance another guaranteed energy service agreement for the purpose of installing energy savings equipment and providing services designed to save energy for the county's properties and buildings. In 2022, the county entered into a contract with Motorola Services Incorporated to bring the county's Astro 25 system up to a current release and to include post-warranty services. The project will be financed as a capital lease purchase agreement between the county and Motorola Service Solutions Incorporated. In compliance with GASB 87, lease payments were added to long-term debt analysis. The county is a lessee for several non-canceling leases of space as the West End Treatment Center, magisterial district offices, and aerial agencies, and the aerial agency on agency senior centers. And you have the statement attached. Any questions?
Any questions on the debt statement? Moving on.
Yeah, I just want to add, those are all numbers that are in other places. We just put them all on one sheet. The second report is an agreed-upon procedure report for hotel room rental tax for the Hotel Bethlehem for the period January 1st, 2021 to December 31st, 2022. Our first procedure is to obtain 2 years of tax remittances from the county's revenue division, inspect them to determine whether the operator used the latest version of the remittance form and that the form was fully completed in a proper and accurate manner. Our findings was we inspected all remittance forms submitted during the audit period and found the operator used the latest version of the county remittance forms and they were completed in an accurate manner. Our second procedure is to interview hotel management to gain an understanding of the operator's accounting procedure. We obtained an understanding of their operating process sufficient to evaluate the accuracy of remittances to the county. Third procedure was to inspect the operator's financial reports to verify the accuracy of remittance reports and compliance with rules and regulations. We calculated all remittance forms submitted during the period and compared revenue on their financial statements. We found the operator remitted the higher of the tax collected versus tax due, and all calculations were accurate. All remittance forms were received in a timely manner. The hotel underreported taxable room revenue and certain months, failing to report as taxable revenue for no-shows, smoking, and rollaway bed fees for 2021 and 2022. The fourth procedure is to investigate the validity of claimed permanent and non-permanent exemptions by testing a sample not to exceed 50. Only 23 exemption claims were submitted by the hotel during the period under review. We evaluated all of them. Only one exemption was valid according to eligibility standards and through supporting documents. 22 were not. They were invalid. And I have the reason for that. They had a soccer team in there from West Point, and they claimed the government exemption, except they were not here on government business. They're here to play soccer. So they were all ineligible. Based on our we calculated the additional tax owed, and we determined that they owe us, Northampton County, $673.34 in hotel room taxes. We conducted this agreed-upon procedures engagement in accordance with generally accepted government accounting standards. That concludes this report.
Any questions? Ms. Fargo Hefner?
Is there a reason why March and December 21 are missing from the report?
I do not know that answer. Let me just see.
We were going to ask about 22. I was going to ask about 22 and the same thing, because it just gave 2 months of last year and it didn't give the other months.
I don't have an answer. I can get that answer and get back to you. I can get that answer and get back to you. I don't have it here.
Anything else on the Hotel Bethlehem report? Anything else for the controller? Then I just had one quick question. The independent audit report, the Home Rule Charter indicates that it's supposed to be completed in 120 days from the end of the fiscal year. We're well past that. Can you update us as to?
We have not heard anything from them.
Okay, then Ms. Zembo, have we heard anything from the independent auditor?
I had contacted them, and they have not completed the report yet, and as soon as they do, we will have them in for a presentation.
Have they indicated any reason why the report?
They did not
is-
provide a reason.
Okay, that answers that. Thank you. Anything else for the controller? Okay. All right, thank you very much.
Thank you.
All right, then next up is the discussion regarding the Employee Health Center. Who do we have for that?
Good afternoon, everyone. Ms. Wondolowski and I are here to make a presentation on the Employee Health Center. I know that we've presented this before. We've recently gone through the RFP process. Commissioner Giovanni was on that committee with us, and he suggested that we bring it to council, what the RFP process was, what our decision was in that process. We do not have the contract tonight to bring to you for a vote or to move forward for a vote. We wanted to give you an opportunity. We wanted to remind you why we think this is a good idea and kind of walk you through the RFP process and how we came to our decision on our choice. First part of it is to remind you why we want a health center. What are the employer benefits? The big reason is healthcare costs are skyrocketing. We know that. We know they're going to keep going up, and we want to find a way not to pass it on to the employees and to save money for the taxpayers. Another reason is health centers can provide healthier employees by providing easier access to healthcare and wellness programs. We know that access to healthcare contributes to better health outcomes. From my perspective as the HR director, I also would like to use it as a recruitment tool. It's a huge benefit to have an employee center, and that is something that we would like to market to employees.
I think you've heard me talk about a lot about employee retention, both in human services and at Graysdale, and we've taken many measures to try to work on employee retention. And so from my perspective, and I think the team's perspective, who participated in the RFP process, this is yet another tool that we have that really would be able to help us work on employee retention. I think that will become, I mean, for me, it's sort of intuitive, but I think it will become more obvious as we go through the rest of the slides. Sorry. So I didn't know a lot about the Employee Health Center before I really got involved in the RFP process. And I think there's a few things for me that I was struck with pretty quickly. Convenience is a big one. So I think we all know that if we're sick, sometimes it takes us a while to get into our PCP, even if you have strep throat right now.
That's primary care physician.
Primary care physician, yes. And so we've seen, and you've heard presentations on the incredible use of Teladoc, which has saved the taxpayers and the county money. This is along the same lines, except that instead of virtually, for folks who really want to become connected with a primary care provider and see them in person and be able to have same-day or next-day appointments, that's what they're able to offer. And because it's just for employees and their dependents who are on the health insurance with the county, they're able to commit to that kind of availability. It went out of my head. Give me 1 second. So I think if folks are not using Teladoc because they want to see someone in person, then they're sometimes going to urgent care, which is a more expensive cost to the county. So I think convenience will be a huge piece. The provider would also provide virtual appointments. So if folks preferred that, whether they were stayed home sick that day, they could use the health center for that, but do it virtually. And I think the difference, for those of us who have used Teladoc, you get a doctor from anywhere whenever you call. So you're really probably never going to have the same doctor more than one time. And so at least with a health center, there will be one PCP and there would be two medical assistants, we'll clarify that. And so it will be the same person. And so whether you're going in person or virtually, you will be able to have that consistency. If you have a PCP that you're happy with and you just want easier access for sick visits and other services that we'll talk about, that will also be a huge convenience. Additionally, this will be centrally located to where the majority of employees are located at we don't have a site yet, obviously, because here we are. And I think just like Teladoc, it's zero cost to the employees, and there's a huge appeal to that. So if you go to urgent care, if you have the HSA, you still have to meet your deductible. If you have the PPO, you're going to have a copay. If you utilize the health center, you have zero copay, zero cost for any of the services that they are providing. So that is another huge benefit.
One of the other benefits to the employees is that it's completely voluntary. I believe it was you, Mr. Myers, that brought that up, and you're concerned that employees would be forced to use it. And I think Mr. Giovanni can vouch that all of the presentations that we saw in the RFP proposal, every single company said it's a voluntary program. None of them say that this has to be mandatory. The idea is we do need employee participation. The more participation, the more successful it is, but we get employee participation with these other things by making it convenient, by saving them money. The other concern that was brought up to me was being confidential. I think with it being a county employee health center, there may be a perception that the county has input on that. We pay the bills, but integrity would run the company. We don't know any more of employee health information than we would if you're going to your normal PCP, and I think that's an important point for employees. Other employee benefits is better health care. They have coordination and communication and referrals between the providers. They have client care specialists, so if you have a medical bill that you get and you're not sure what to do with it, why did I get charged? They have help for that. You can go in and help with that. If you have a complicated medical condition and you go in and you need to be referred to a specialist, they will help you find a specialist. And their doctors there will talk to the specialist so that they know. I know I've had situations where I'm trying to figure out what's wrong, and you're going back to your primary care, then you go to a specialist, then you go back to the primary care, and you're the conduit for communication. The Employee Health Center does that for you, and that makes for better healthcare outcomes. They also can manage chronic conditions for employees. The other part that I already mentioned was the concierge claim services for employees. That's, like I said, that's two parts, where you have claims, you have questions, somebody can walk you through that. And also, if you need help getting appointments with specialists outside of the health center, they help you with that as well.
I think we've talked about it here already, but based on the employee engagement survey that was done, I don't recall the number of responses we got offhand, but it was a larger response than is typically found in surveys. And it was overwhelmingly in favor and support of the Employee Health Center. So I think additionally, we talked with Mr. Giovanni a lot about the fact that our employees really utilize Teladoc a lot. So literally in the Human Services building when I'm there, I really can't tell you how many folks have said to me, oh, I called Teladoc for my son, or I got pink eye, I called Teladoc. So I've heard firsthand how frequently people utilize that service. And so I think there's every reason to believe that employees would be very receptive to a health center as well. And obviously, I think you all are aware that we have support from the major unions here at the county who are very much in favor of expanding healthcare access to employees while not having to raise the cost for them or pass it on to our taxpayers. So we just wanted to kind of talk briefly about what the RFP process was. So there were 5 of us involved. It was Mr. Giovanni, Mr. Barron, Mary Lou, myself, and Kathy Anderson. We received 5 proposals, I believe, that we reviewed as a group, and together we all narrowed that down to 3 proposals and ended up offering an interview to each one of those groups. When we were going through the proposals, there was really 4 categories that jumped out at us in terms of, comparing apples to apples and trying to get a sense of which folks were most in line with what our goals and objectives were. Obviously, cost is always going to be at the top of the list. Guarantee or return on investment was another one. Hours of operation, which we'll talk about, and the concierge service that Mary Lou already mentioned. So from the 3 interviews, which we did over the matter of about a week and a half or so, 2 weeks maybe, afterwards we had a brief sort of exit interview together and then had another follow-up conversation via Zoom after best and final offers were submitted by those 3 companies. And ultimately, the RFP team, I'll call us, reached a unanimous decision in terms of which agency to recommend. So the top 2 ultimately that we really quickly narrowed it down to were Integrity and Everside. And so we outlined a side-by-side comparison of those 4 major subject areas for you to see, because I think it's, the RFPs are just huge documents and really cumbersome to read through. So I think this breaks down some of the most important pieces. So I will not read every year and the monetary costs, but you will see that ultimately that Everside was about $1.5 million more expensive than Integrity. So that was the cost difference between the 2.
So next, let's talk about the guarantee. As I know, Mr. Goffredo, that was something that you brought up, a guarantee on return on investment. And Everside does offer a guarantee. If you don't break even in 5 years, they reimburse the fees. So obviously, that was something that perked up our attention, and we really took a look at that. And we came back to Integrity and said, do you offer that? They don't offer a return on investment. And part of that reason, and it's a reason that was going through my head as well, is perception. So if employees know that the health center has a financial incentive to save money, the perception would be sort of a discounted healthcare center, and that may discourage people from using it. And obviously, if we do this, we need employees to participate. That's what makes it successful.
Can I just stop you? Like, I understand that rationale, but wasn't that the major selling pitch coming here to save money? Why would guaranteeing that be any kind of disincentive?
I think the guarantee just creates a perception, because we do want to save money. So like I said, that was one of the things with Everside that was very attractive to them. But obviously, in the slide before, if you look at the cost, that was mitigating on their return on investment. So what Integrity does is offer performance guarantees. And we can negotiate with them to get that included in the contract. It makes them meet quality measures.
One of the questions I asked Mr. Gafredo is, of each of the three companies, is if you look at any one 5-year period that you worked with any of your agencies or contractors, did you ever not have any return on investment, right? So did you ever lose money over a 5-year period? And I picked 5 years because I figured, if you look over the years of COVID and stuff, maybe there's, from year to year, there might be some nuances, but over a 5-year period, I thought that was a fair question. And so despite the Integrity's unwillingness to provide a return on investment because of their philosophical and fundamental beliefs about why that's bad for employees, none of the three companies experienced losses if you looked at 5-year chunks of time. So I think what all three companies were able to demonstrate is that they in fact all three did have positive returns on investments over the lifetime of their work with different folks.
Mr. Brown?
Based on the guarantee, so over the 5 years, they would potentially fork back to the county $120,000 if they don't meet. Is that every year? And what are the actual ROI measures per year? Because if I'm looking at it, $120,000 against $3.7 million, I'll take that all day long. That's an easy give back for locking up a contract.
It's negotiable, and we have to go back after, as Mary Lou said, we wanted to allow, per Mr. Giovanni, time for everybody to see this, digest it, and ask follow-up questions. So that's something that is we've already discussed with Integrity as being negotiable. So we haven't picked out, the RFP team didn't pick out metrics to measure at this point. So that's something that can be done and will be done. And I think what we talked a lot about with Mr. Giovanni is the fact that Everside cost year over year is so much higher. So after 5 years, it's $1.5 million. So yes, they offer that guaranteed return on investment, but if we retain them year over year over year, even with the guaranteed ROI, it will cost the county significantly more money. And so the RFP team felt like, I don't know if Mr. Giovanni wants to jump in, the RFP team felt like the $1.5 million directly upfront out of pocket over the first 5 years wasn't necessarily worth it because of the fact that none of the three companies sustained losses over any sort of 5-year period.
Mr. Giuffredo?
While we're talking about the money part of it, how do they calculate what they're considering their costs? Are we including soup to nuts, everything that goes into the facility, whether it's maintenance on an x-ray machine or somebody fell and they sued and their insurance premium went up, that's going to get taxed? How conclusive? What is the, the scope of what they considered the expenses of the facility or the center?
So I think other than the build-out costs, so if we leased a facility, whatever build-out was done is not included in the cost page that you see. All three companies were roughly around the same cost, which I don't recall off the top of my head. I don't know if Mr. Giovanni does. But they were all comparable, so there was no big discrepancy. I think generally speaking, it includes everything soup to nuts, but there's probably some nuances to that. So the folks from Integrity are here, and so if you have particular questions like that, you can absolutely, I don't want to speak for them.
All right. So pass the guarantee.
Mr. I just wanted to ask,
Jackman?
Tom, wasn't the number between 2 and 3 million for the build-out, if I remember correctly? The initial build-out, somewhere in,
Somewhere in that,
Yeah.
if we purchase.
okay. I thought it was somewhere in that range.
So back to, this weighs into, Mr. Brown, into your question as well, because cost is, I think I listed it as the number one factor, right? That would be of importance to us to consider. But hours of operation are also important. So I think it's critical to know that in Everside's proposal, they were willing to be open 6 days a week for a total of 40 hours. So they said we could negotiate, what days of the week and what hours we were open. They could do evenings, they could do early hours. But it was 40 hours over 6 days. So more than 40 hours, more than 6 days would have obviously increased that price. Whereas Integrity was providing 60 hours a week over 7 days a week. So their hours right off the bat without having to negotiate anything are Monday through Friday, 8 a.m. to 6 p.m., and Saturday and Sunday from 8 to 1. So anybody with kids or nieces or nephews knows that Saturdays and Sundays and after hours is when our kids get sick or hurt. And so to be able to have that, if not everybody's pediatrician or primary care physician is open on Saturdays and Sundays, most are not, especially regular PCPs for us adults. And so those hours are flexible in terms of, we certainly can negotiate those, but that was a substantially higher number of hours Integrity was willing to offer for a less expensive cost. And based on the fact that folks can utilize it before work, during work, and after work, and on the weekend, was a significant factor in our final decision.
And just to add on that, I think that, again, that's the importance of trying to make it very convenient for employees to use, but also helping our costs, because people may use an emergency room or a more expensive center on those weekends or off hours. So we felt that that was an important point as well.
Question?
Yep, Mr. Myers?
Who's this eligible? Is part-time people or just full-time people?
The people who are enrolled in the county health benefits are eligible.
What's that number?
I'm sorry, I don't know that off the top of my head. I'd have to look that up and get
Because you're
back
going
to
to need
you.
numbers for this to be able to operate. Okay.
Oh, yeah, we've provided them with all that information
Yep.
in order to do the proposals, yes.
That was my, okay. I was getting to that point, you answered that question. Okay.
Ms. Fargo Hefner?
Who's our current healthcare provider?
Capital Blue.
You're talking about Capital?
Blue. And when's our contract with them up, or do you renegotiate every year?
Every year.
So how are we saving money if we're still doing Capital Blue and then we're adding this? Explain that breakdown to me.
So it's not adding services, you're already paying for these things. If people aren't going to the health center, they're going to their doctor. It's just an improved, better way to do it. It's not fee-for-service the way traditional healthcare is. It's just a different healthcare model. So you're paying the same things. I'm going for my strep throat, whether I go to the health care center or whether I'm going to my primary care doctor.
And if you go to your primary care doctor for a sick visit, you're either getting a copay or the employee's, paying with it if they have the health savings account, but the county's getting a bill for that visit. So I think that's what Mary Lou means when she says, either way, we're paying for it. So if the employee goes to the health center, they don't pay anything. The county has that cost already built into it, and it will be less than it would be, like if you averaged all that out, for the employee to go to their primary care physician or an urgent care situation. So the county's paying for that if the employee's going to a doctor outside of the health center. That's the self-insured bill that we get. Is that?
Go ahead.
Just want me to- So,
it.
I feel like I can answer the question too. The insurance basically is what we pay when somebody is being serviced. And if we're servicing them here in our health center, we could control the cost. And if we send them to a hospital where they spend $40 for an Advil or $200,000 for, whatever procedure, we could probably have that at a cheaper service. But I guess the trick is predicting how much is used in our health center and how much is used outside of the health center, right? That's why it's like the whole guaranteeing savings. It's got to be really, really tough to do if you don't know how it works out as far as who's using what, right?
Right, and that's why utilization is key, and that's why we want to make it convenient and cost-effective, because that really is what motivates employees, that will motivate employees to use it.
Okay.
And I think, if I can just add, one of the things we spend a lot of time talking about, someone like myself, I'm not willing to necessarily give up my PCP for my annual well visits, right? But when I have the strep throat or the ear infection or the whatever, or I need an x-ray or I need my lab work, I'm not wedded to my PCP. So there'll be people who still want to use their primary care physician, or if they have a specialist that they stick with, that's all fine, but there's a lot of services that folks would be willing to go to because of the convenience and because of the fact that there's no cost. So we did spend time talking about that.
Mr. Myers, you had a,
I know Lori was done.
Ms. Fargo?
So I still didn't get the answer to my question. So the first year that we agree to them, you're not going to change the Blue Cross, you're not going to change the Capital Blue contract at all? You're not going to amend that at all?
No.
So we're not really saving money the first year. We're spending money for them, and then we're going to keep the regular thing. And as we see that people are utilized, we may amend the Capital Blue contract, because I don't see where we're saving money by adding people.
So we're self-funded, so we're not paying a premium per employee. So there isn't a set cost that we're paying to capital. We're paying the actual fees when I go to the doctor. That bill gets submitted, the county pays for that.
The
So,
less you pay, that's the,
exactly, yes.
Because we're self-insured.
Mr. Myers?
Prescriptions. If they go there, do they have to go to the pharmacy or do they get prescriptions there? And do they have to pay for the prescriptions there?
They do have prescriptions there. They're limited. They don't offer anything that's a controlled substance. But
Right.
if you go and have an infection, you can get the prescription there for no cost, right?
Correct.
No cost. And those types of common prescriptions will be there, but not everything will be there.
Okay, what about flu shots there or back to the PCP?
I'm not sure that's something we covered.
Yeah,
I'm sure it's something that can be asked of Integrity since they are here. Certainly something that could be negotiated. We didn't ask that. I think we did talk about vaccines, though. Yes. Yes, they do. They do the flu shots for all the companies that they work for.
So anything that's preventative they could possibly use and not incur by going to our personal doctor?
You got it.
That was my question.
You got it.
That's interesting. Okay.
We're on benefits management. Did you want to finish that one up?
Thank you. So comparing Integrity and Everside, Everside had employer-focused, where we do claims review. That's something that we already do with Blue Cross. We go through that. Integrity, as I mentioned, has the employer and the employee side. I think it's a big benefit. I know I've said it a couple times now with this claims service specialist for employees. When you have a bill or a problem with your insurance and you don't know where to go, do I call the insurance company? It's like 10,000 phone calls. They have someone dedicated there to help the employees with that, which I think is really important. And they work on behalf of the individual covered by the plan to help them with that. It's not just for the employer, it also focuses on the employee. And they give one-on-one support. Again, we talked about a concierge service. They can help you make appointments. They can get you in faster with specialists than if you're calling on your own.
I just had one more point, I know Mary Lou touched on it at the beginning. When we finished our interviews, one of the things Mr. Giovanni mentioned was the elephant in the room, right, that none of us want to talk about, which is like the skyrocketing healthcare costs. So I'm not the fiscal expert, I realize that, but to me, when I hear about those costs, which I think everybody has heard about, at some point, I know in 5 years that I have been here, the contributions the employees make towards their health care plan have not increased. At some point, either the employees are going to have to pay more for the benefits they already received, or that cost will be passed on to taxpayers or such, right? None of which this administration is not interested in doing. I'm not saying that. Point is trying to find a creative way to figure out how to allow employees to have even better health care, even more benefits, and over the course of 5 years and beyond, actually saving the county money. So I just wanted to mention that. Mr. Giovanni, do you have anything that we missed?
Covered it all.
Okay.
The only thing you didn't cover was the building and the equipment and where we thought.
That was my next question.
So we talked about, I mean, Mr. Giovanni can comment, we talked about, I mean, the administration is certainly agreeable to a lease as opposed to purchasing a building, ideally finding a space that's already situated for medical offices, which would reduce the build-out costs. Mr. Giovanni, did you want to add anything?
My concern was, we really don't know how the ROI is going to flesh out. But I guess the best way to approach it would be on a lease. Lease a building, lease the equipment. Because in that point, if the new executive comes in and says, I don't want this program, well, we don't have nothing purchased. We leased. We cancel it all. That was my biggest point. I said, I don't want to own a building. I don't want to own equipment. That's not our job, as far as I'm concerned.
So is that part of the arrangement? Because that's the question I was going to ask. Leasing the equipment in the building is the way we're going?
I can't speak to the equipment, but I'll let Integrity answer that. But leasing the building, yes.
Yeah, and I did want to add, we do have members from, representatives from Integrity, so if you have specific questions for them, I'm sure they'd be happy to answer them too.
That's one question I would like an answer for. Are we leasing the equipment or are we buying it?
Well, let's hear from Mr. Heckman first, and then we'll hear from.
You probably can answer this if they can't take it. When they first made the presentation, I see we have a total of 60 hours per week. Everside is a total of 40. And Integrity's 8 to 6, Monday through Friday, Saturday, Sunday, 8 to 1. They indicated that as time, they would watch over time, and they might be able to flex those hours if it was, let's say, it's better for employees 9 to 7, because as you mentioned with children and coming home from work, you might be pushing it at 6. I believe they were amenable to considering that as going forward. So I just believe that was what was said originally. I'm sure that hasn't changed.
Yeah, and I think it's, to your point, it's the more employees use this, the more
Right.
savings the county will have. So if we find that between the hours of 6 and 8 p.m. Monday through Friday would be really high utilization rates, we can adjust start times, we can adjust weekend hours. So absolutely, they'll be able to track that over time and adjust as necessary, for sure.
Yeah, I mean, this entire thing, success-wise, is employee-driven.
Yep.
Regardless of what any of us say anyway, it's going to be up to the employees to make this a success if we do it. So, thank you.
You're welcome, and I think it's worth repeating a third time. I think Teladoc was far more successful than anybody imagined it would be. I think we were confident that it would be successful, but it is so successful that I think that speaks to employees' willingness to do things a little bit differently with their health care than maybe, years ago or generations ago.
And the Teladoc speaks to the cost and the convenience. I think that's what drives it. And I can tell you at Teladoc, every time we have our reviews with them, they say Northampton County is our star client. We use you as an example all the time because we do have really high utilization.
Mr. Brown?
Just a couple comments. said this is a potential employee recruitment or retention benefit that you could add, but basically the county's paying 100% of the healthcare costs for our employees, short of what their salary contribute, the 3% or 5%. So this is on top of the 100%. I'm not sure there are many employers out there paying 100% of healthcare costs for their employers, so I don't really see that as being a retention recruitment
Well,
benefit.
the county's not paying 100%. I mean, each employee's paying a portion of their healthcare premiums each month, so that's,
They'll still
that's
be
the first
paying-
issue.
They'll still be paying a part of their premium. right?
correct.
Correct?
So the advantage to the employees in terms of the recruitment and the retention piece goes back to cost and convenience and access, right? So
Right, no, I
cost-
get it. So you make
yeah.
it more convenient to have your healthcare.
And they don't have to pay to go to the health center. That's for the.
If there's a cost, you go to your doctor right now, you may have to pay $20.
Correct. Yeah, you either
Now
pay your
don't have to
copay-
Do that, so.
Right.
okay.
Yep.
So that's part of it. In looking at the ROI, the cost of our health care basically comes down to prescription costs, right? And managing the portfolio of drugs and staying on top of that, making sure that's negotiated with the vendor, and that's all the back stuff. I think Integrity had a lot of experience with. I think the CEO actually came out of that industry. So that's one of the big chunks of cost that we're incurring. And I have no doubt that they can do that. The second part is what was touched on was utilization. So basically, how frequently is an employee going to a doctor or an office somewhere, getting some medical treatment, and then that's billed back, and that utilization has to be managed. That's the other part of what I'm sure both companies are offering. We can do better at that. The challenge that I have with this proposal, and I'm not quite clear on it yet, is your presentation is comparing Integrity to Everright?
Eversight.
Right, okay, and that's great. Okay, yeah, $1.5 million, I get all that, more value on this side. What's not being compared is the healthcare center to a more traditional approach where you add a 10% copay or 10%, a 90-10 PPO type of program. The utilization in the studies and articles I've read is based on the fact that most of, if you have 100% being paid for, then I don't have any incentive to shop around. I could go in to see Dr. Cusick. He charges $100. I could go in to see Dr. Gaffredo, $500. They actually share the same office. I just went in two different doors. But there's no incentive because it's not coming out of my pocket. So there's a big part of managing the utilization of that process, which is really consumerism. If I know I'm going in to see Dr. Gaffredo and I got to pay 10%, against his $500 fee, or I could go to Dr. Cusick and pay 10% against his $100 fee. Well, where am I going to go? I'm probably going to drift over to Cusick. The management of both of those pieces is really what we're paying Integrity to do. The 80%, I think, or some, I forget the numbers when I looked at this originally, 80%, the county's already offering of all of these benefits. The convenience part, I'll give you that. If I can go down the hall and around the corner, that's the 20% on top of that. What I'm struggling with is, I think the $3 million build out or whatever that number is, and then we're paying $700,000 on top of that in order to provide for that 20%. When I think you could potentially take a look at, for a far less number, manage the prescriptions, manage the utilization, some costs back to the employee, because until you introduce consumerism, you're never going to get the ROI that you're actually looking for. I see this as just being, we're stacking more cost on a long-term basis into the healthcare costs that the county is going to be paying. We're moving it around. We're kind of redecorating it and putting it over here. But ultimately, I just think for the 80%, that we could get that done for far less money than what's being charged for the healthcare center concept. Now, that being said, that's what I'm struggling with. You're locking in long-term costs for something that 80% of which we're already providing to, most of which we're already providing to our employees. So why would we spend that much more money on the ROI? And the ROI is based principally on prescription management and utilization management. Those are the two, that's going to be the 90% that comes out. The other 10% comes from the convenience and managing the long-term prospect of the employee care. You see a patient over long-term and you're managing that, make sure they show up. They go in sooner instead of letting it become more chronic, those kind of things. I'll give you the 10% on that. So that's really the struggle I have. I'm not opposed to the concept, but I think your comparison of one healthcare center to another versus a healthcare center versus a more aggressive traditional plan is, I think, really should be undertaken to really look at what is the investment that we're making and what is the ROI in terms of the dollars being spent. The county could still elect to go, the healthcare center is still more what we want. The ROI may not be as high, but longer term, maybe that's the decision that you want to go. But that financially, that's the struggle that I'm looking at. The other part that I want to raise, and you didn't address it, most of the healthcare centers that I've looked at have multiple participants outside the primary county. I think correct me if I'm wrong, but in New Jersey, there's 4 or 5 entities using it outside the county, or county other agencies that may be.
Well, if you could just come up and state your name.
I tried to remember, but I think there were like 4 or 5 other entities that eventually came into you created the plan, and then eventually other local entities became participants in the plan outside the county proper.
Yeah, if you could just state your name.
Yeah, I'm Mark Calaguire. I'm with Integrity Health. I'm sorry, yeah. So what we have is something called reciprocity. So each of the health centers is dedicated to the employees of the sponsoring entity. So we don't like to mix apples and oranges, but we have reciprocity. So if there are other healthcare centers in the area, which can be, liberally construed, you can go to another one of the partnership health centers, even though it's not sponsored by your organization, and we, from an accounting standpoint, deal with it. So, for example, if Northampton, you're not near Lycoming County, that would be absurd, right? But we're working with other counties and other entities in Pennsylvania. So if you have an employee who's in your health plan, therefore can use the health center, and we have another client, which could happen, not too far away, and they happen to live closer to that, they can take their family member there. They can go there, and we will, from an accounting standpoint, deal with it. So it's not other people can use it. It's really just a service we provide to make it.
In the presentation that you provided in terms of your original number of participants and outcomes and the original paper work that we received from the model in New Jersey had your ROI and calculations on that there were at least several different entities that were participating within that total. The 819,
Yeah, Commissioner, I don't know what you're referring to, but we can certainly look at that with you and figure out what that is. But
my concern being that this is supposed to be dedicated to our employees.
Correct.
But I do believe even like Lycoming County, while as excited as they are to get theirs up and running,
Right.
Has already mentioned that they're going to be reaching out to the city.
Right.
To bring them in and participate.
Right. Well, that's smart. That's smart business, right? I mean, if you can do that, you do defray some of the cost, which would be a good thing. And if it's an entity which is right there, it makes sense. So, I mean, we would highly encourage if you do this. We hope you do. If you want to approach the local school board or someone like that, we would certainly encourage that. But it doesn't have to be that way. You have plenty of employees to be able to do this.
So you're moving into a regional health center concept?
You could, and we'd be happy to work with you on that, yep.
Okay.
again, I didn't want to
That's
steal
all.
your thunder.
Wait,
But- yeah.
any other questions for Integrity while he's up here? Mr. Heckman?
Yeah.
Hi, Mark.
Hi.
We communicated in the
Yes, sir.
past.
Yeah.
Does Lycoming County, do you also do their retirees as well as their
Yes.
employees? I thought
Yes,
you did.
if your retirees are in your health plan, anybody who's in your health plan can use it. Now, you also can decide, I mean,
Right.
to extend that to,
I don't think that's the plan up front if we go with it, but I just wondered, I could see how that could conceivably be something that could come about.
Definitely a possibility.
yeah, it's your health center, you could decide access as you see fit. If you wanted to expand that, beyond, yeah, that's.
Because that's always been an ongoing discussion with the retirement board, healthcare, and I know we've done things, but I thought when we talked,
Yes, sir.
Lycoming was coming in with their retirees.
Yes.
And I know we're not doing that out of the gate, but
Yeah.
we could, if there's a disposition to do it, your
Yeah.
company is open
As
to
ma-
that as we move forward.
Yes, sir. As a matter of fact, Judy and I met with their retirees about a year ago. There wasn't as big a crowd as, as the retirees who were there to hear what we were all about.
Yeah, okay.
Yeah.
That's all I wanted to know. Thank you.
You did have one question. I didn't want to interrupt them, but you had a question about leasing versus purchasing?
Yes.
Okay,
Me.
so that's really something we would work with you guys on, depending on what works best. For example, Judy, you should come up, but Judy is the person who'd be primarily responsible for the fit out and the hiring. But if, for example, X-ray machine, right? We do radiology at the health center, and that was included in the RFP. If it made sense to lease it versus purchase it, we would certainly do that with your input. Having said that, X-ray machines don't cost as much as I would have thought they did. So we've usually just purchased it with cash. We're talking $30,000, something like that. So, I don't know, but does that make sense, Judy?
Sure.
Did I get it right?
You did.
Thank you.
You did it
All
good.
right.
My name is Judy Lagana.
Yeah.
And I am the Chief Clinical Officer for Integrity Health. What I will tell you is that we have startup equipment costs that I think that was given to, to you to look at. Those startup costs, we have equipment such as, I'm just going to name some things for you. X-ray equipment obviously would be our highest cost. That could be leased without a problem. Other equipment we would outright purchase. They're all pretty much under $1,000 worth of equipment, and this equipment would last quite some time. So we have worked with vendors for medical supplies, medical equipment for a very long time. So we do have really good pricing on that. Medical supplies, as you know, since COVID, some medical supplies have gone way up, some have come down. We right now are seeing that our cost for supplies is coming way down, and the need for certain supplies have come way down as well. So we'd be very conscious of that and work with the client. The other question regarding the entities of other PHCs and how they function, whether they have reciprocity or not, that is up to them. The school systems that we have, the PHCs, all want reciprocity. One of the school systems is now wanting to bring in the township to come in. We have a county in New Jersey that doesn't want reciprocity. They have chosen not to do it. However, they have brought in other smaller entities to come in and help diffuse that cost and the expense.
All right, you know what, so in Somerset County, New Jersey, there are other entities,
Correct.
but they're county entities. The Park Commission, the VOTEC School, they're county entities, so they're not, now it struck me what you were referring to. Yeah.
Mr. Myers, you had a question?
Yeah, reciprocity, so you're saying that if one of our employees say they're, we're close to Jersey Shore.
Sure.
And when their children get sick, they can go to one of the other places and there
Correct.
wouldn't be a problem? Is that what
Yes.
you're telling us?
Correct. Yeah, there would be a simple agreement. So the people who are visiting Easton from the Jersey Shore could certainly, but.
We get a lot of that.
We do have things in Easton now, just so you know.
I was hoping someone would pick up on that. Thank you, Commissioner. But no, yes, that's something we could do. That is absolutely something would be, we've talked about that with other people yeah.
That's interesting.
Yep.
Okay.
Any other questions for integrity at this time or for HR? No? Okay,
Just-
so I guess what's the next step in the process?
So one final piece, I just want to reiterate, it's a very real possibility that retirees would be able to access his health center. So I just wanted to put that out there.
That's a change.
Say that again?
That's a change, because originally we asked that and the retirees weren't part of it.
Well, they very much can be.
I think that was up to the county and in conversations with administration, that's a very real possibility. So, Mr. Cusick, I'm sorry, what was your question, the next steps?
Say, what are the next steps in the process moving forward?
So, Mr. Giovanni had asked us to come tonight to give you guys the presentation and allow you time to take it back and digest it if you have additional questions. I think the thought process was to put it on the full council agenda for the first meeting in July. That's what we talked about? No? The finance? Finance? Yes. The finance meeting in July, my apologies. And then from there, determine if it's moved to the full meeting.
Just one point of order. Can the two people from Integrity make sure we get their information and their phone numbers in case there are questions?
Yeah, I have all your emails. I mean, I can email you. Well, maybe it's better if it comes from you, right? You have all my information. So if you
As long as it gets to one,
if you would
to our
send it to
staff.
them, that would be wonderful.
Yep. Thank you.
All right.
All right, thank you.
Yeah, and thank you for going through this process. I think it was worthwhile.
Thank you.
Thanks.
Thank you.
All right, moving on. Discussion regarding Administrative Code Article 13 contracts. Letter A, Bill for Electric, CMG of Easton, JBM Mechanical. Mr. Amelie?
Good evening, Commissioners. These are the three contracts for the conversion for the Graysdale nursing, or the Graysdale daycare.
Okay.
Any questions?
I got one.
Mr. Gifredo?
Question that we always ask, did you have multiple bidders for all these items?
We did. There were 2 bids for the electrical, 2 for the GC, and 3 for the mechanical.
Wonderful. Thank you.
2 and 3.
1 was withdrew for the mechanical.
Okay, and just to note, the entire contract is $562,399.
Correct.
The electrical is $108,449. General construction is $329,950, and the HVAC mechanical is $124,000.
Correct.
Any other questions on this? Do we have a motion to recommend approval? Okay. We'll move it on to tomorrow night. Then the next item is H&K Group.
So this contract is to pave the stretch of the roadway that's in front of the Greystone building. It essentially stretches from Penn Allen Road south to the Graysdale parking lot in front of the tower.
Just blacktopping?
Yes.
So this contract is for $87,286. Certainly, this is work that needs to be done, but I see that 10 firms accessed the document, but only 1 bid was received. To what do you attribute that to?
We did, one other bid was received, and unfortunately it needed to be rejected because they did not submit all the required paperwork with it. So there were 2 interested firms. The only other, I mean, it's a relatively small project in terms of paving, so that might have discouraged some bidders from placing a bid.
Mr. Gifredo?
Was the rejected bid comparable to the one that you received?
It was, yes.
Any other questions on this? Do we have a recommendation for tomorrow?
Recommend.
Okay, move that ahead.
Yes, recommended.
Next is Keystone Consulting Engineers. Mr. Amelie? Oh, Mr. Barron?
Good evening, council. This one's mine. Keystone Consulting Engineers was the group we contracted with, well, worked with, I should say, through Habitat for Humanity with regard to the affordable housing project in Forks Township. They drew up our plans so that we knew we could do what we needed to do with the land to create the 50 units of affordable housing. Now we need to actually get the mechanical drawings and the engineered drawings for the Zoning and Hearing Board to be able to move forward. The contract is over 153,000 or over 100,000. Council needs to approve it. They have already done all the work. They've been doing work with us. They have the plans largely drawn, and now they're going to convert them to the technical drawings that we need for zoning and hearing to have the project approved and move forward.
Where exactly is this located at, Steve?
It is off of Kesslerville Road. Do you know where the driving range used to be?
Yes.
That's the property.
Okay.
Okay, so this is for $153,000.
Yes.
And I guess my question is, do we have a breakdown on what the cost per unit will ultimately be when this is built out?
So the answer to that question right now is I don't have it today. Habitat for Humanity, once we go through zoning and hearing and all that other stuff, Habitat will come back. And they will have that breakdown as we get closer to building the units and breaking ground, figure out who the sponsorships are going to be for the houses initially, because that's how Habitat for Humanity works. We will be able to have a lot more of that breakdown for you, and where the rubber meets the road with regard to the finances, where Habitat picks up, what the mortgages and banks will finance, and then the sweat labor, the volunteer labor, along with the donations that Habitat for Humanity gets. And that's the advantage of working with their 501c3.
Okay, yeah, I think the reason why I raised this is because I saw the cost for the Glendon proposal is just going through the roof. So is inflation playing a part in this process?
Steve is here from Habitat for Humanity. I know he can speak to the cost of building supplies. I don't think it takes a rocket scientist to figure that those are all going up post-pandemic. The one thing that is great with Habitat for Humanity, and while we all see the feds froze interest rates, or well, didn't move interest rates up at their meeting, I guess, earlier today or yesterday. Habitat for Humanity, when they approve people, it's the sweat equity. There's, no interest rate. These people can, market rate housing, workforce housing, which I think is a really, great thing to have in the Lehigh Valley for people who are getting priced out of the market, quite frankly. And that's really where this project is unique from the Glendon Hotel project.
Okay. Any questions, Mr. Myers?
How many units are we going to put there?
We're at 50 or 51 right now. I don't remember where the final count was, but it's going to be that number.
But that's what I was curious, because that's a lot bigger than people realize.
The property, I'm surprised how many units fit there, and I'm hopeful. We're not asking for any variances with the project, with the proposal we're putting forward. So that should be encouraging to the members of council. So what we're drawing here doesn't ask for any variances.
Just took away my driving range.
Sorry. It's been gone for a while.
My game's been weak. Okay.
Any other questions for Mr. Barron on this? Okay. Mr. Brown?
Steve, on the backside of the document, the excluded services, which Keystone is not doing, how are these being picked up then?
Which excluded services are you talking about?
The following services is on the second last page, right before the signature page. You have a list of excluded services that are not excluded from the scope of this proposal. Zoning appeal, a comprehensive traffic study, permitting of right-of-way.
So they are actually, the site plan itself is actually what's going forward. This is just the engineering. when we engage the other parts of the project, whether Habitat is going to pick up those costs, whether we are going to apply for grants to pick up the costs, we will be bringing those back to council through the procurement process and presenting those to you. This gets us to the next step.
Thank you.
Anything else from council? Anything else for the Finance Committee?
Just a quick
Mr.
question.
Ekman?
Well, I have Mr. Amelia here and, well, Steve, and also, what's that? Oh, I'm sorry. I just wondered, I asked you the last meeting about the memorial at the Human Services Building for Sarah. Has anything, I'm just curious where we're at with that, if anywhere at all.
Yes, I actually spoke with Mr. Cope earlier this week about that. We've identified the location at the Human Services campus that we think is the best spot for it, and that the tree will be planted by the end of next week.
And we're going to still do a plaque and a bench, because that was in the resolution.
Yes, the plaque is on my to-do list. The bench, we have to figure out if there's a place we can put it out kind of by the tree.
Yeah.
We bought a whole bunch of new benches during COVID, actually, to have people have a place to go outside, so.
No, I just.
So there'll be, yes.
The progress report. I'm leaving it up to you guys how you put it together, but I just thought it would be nice. Thank you. That's all I had.
Okay, anything else? Okay, move to adjourn the Finance Committee meeting then? Okay. And we're done, thanks.
Linda, could we take like a few-minute break?
What's the next one?